how many years of your life you spend sleeping. If you have 70 years, you're going to spend 25 years, almost of your life sleeping.
Crazy.
And you spend 6 to 7 years of your life trying to get sleep. If you're going to spend 33 years of your life somewhere doing something regarding sleep, it has to be important. Irregular menses for girls, etc. can all be linked to irregular sleep habits. Sleep is restorative. It restores your mind and it restores your body. Sleep is not even taught in the medical curriculum. So even doctors are not trained in sleep. Everybody told me you will not get a return on investment. I just went and did it because I felt it was a felt need. There is so much of stimulation, so much of information given to the child that the child's mind is not at rest. Now this is a kid who will have a breakdown one day. They want to spend time with the child. So they will keep the child awake till 11, 11:30, 12. So children are now sleeping later than what they should have been sleeping. By evening, they're dead tired. They're walking like a zombie. Your cognitive skills, which will show decline if you keep on doing this. If you don't sleep well, you become obese. Nobody talks about the pandemic of obesity we are sitting in.
Everybody thinks a snoring kid is so cute. How bad is snoring for children?
So 15% of children will normally snore. Children who have snoring notice gasps, snorts, noisy breathing, wakenings are abnormal snoring. The body will wake you up because you can't breathe. You have to get up, otherwise you will choke to death. So you will get up to breathe again. And then you go back to sleep. The whole process starts again. Your sleep will get totally disrupted.
And what does that do to a child's face, jaw, and teeth?
So what we call is adenoid facies. You can see a child whose shape of the face has changed. It becomes long because he's constantly mouth breathing. And if not rectified, can actually change his looks in the future. In children, the commonest reason is
Things like rocking the baby to sleep, breastfeeding to sleep, lying down with them, jhula, all these things. Parents love doing it all. But you call these all props.
They are called props because then the child is dependent on them to go to sleep. Let the baby soothe himself or herself to go to sleep. If parents are firm, it takes only sleep train a child.
Dr. Indu Khosla is a pediatric pulmonologist and sleep specialist who has spent decades seeing what poor sleep really does to children, parents, and families. We discuss everything about sleep, why children are sleeping worse than ever, why screens are destroying bedtime, and why tired children often look hyperactive. What I learned is that most sleep problems are not created by the child, but by the lifestyle around the child, which we are responsible for. This is a must listen for every parent. Okay, small pause. This is the part where I'm supposed to ask you to subscribe. But honestly, only do it if you want more conversations that actually make you think. That's the whole point of the secret sauce. Alright, back to it. For someone who doesn't know you, can you tell us a little bit more about who you are and what you do?
So I'm Dr. Indu Khosla. I'm a pediatric pulmonologist and I also work in the area of sleep medicine and allergy. Sleep medicine is a part of pediatric pulmonology.
So sleep is a subset of pulmonology.
Yes, it's not sleep as one would what a normal person will understand, but it is sleep disordered breathing, and what happens to breathing during sleep brings sleep into pulmonology.
Because sleep is so linked to breathing, I guess.
Yes.
So doc, first I just want to understand a little bit more about sleep. Because we think of sleep as something for children or for people that you shut the door, good night, and they sleep. And then they wake up. That's what most people think. That's what sleep is. But of course, it's much more complex than that, as we're seeing more and more now. So I just want to understand, what is sleep?
Okay. To highlight the importance of sleep, I want to ask you a question. How many years of your life you spend sleeping?
1/3.
Yeah. Wow. You're well informed. So we spend 1/3 of our life sleeping.
Yes.
And so if you take an
If
average...
you're lucky. If you're unlucky, it can be 1/4 also.
Yes, of course.
1/3 is the ideal.
Yes, of course. So if an average human being lives, say, about 70 years, the longevity is now increasing, of course, especially even in India. So if you have 70 years, you're going to spend 25 years, almost of your life sleeping.
Crazy.
And you'll spend 6 to 7 years of your life trying to get sleep. When you get into the bed, you're lying down. For some it may be long, for some it may be short. So if you're going to spend 33 years of your life somewhere doing something regarding sleep, it has to be important, right? So nature has designed this because lots of thing happens in sleep. In today's generation, we say, why sleep? Yaar, ut jao, bahut sara kaam hai. If nothing, at least, kind of.
The world is passing by.
Yeah.
Why do I want to miss the world?
Why sleep? But unless you sleep, you cannot do the rest of your, you cannot do the rest of the things you want to do in life properly. So sleep is very important. Sleep is restorative. It restores your mind and it restores your body. Okay, so when you sleep, you get up physically restored and mentally restored. Sleep is required for immunity and growth. All right. If you look at evolution, sleep, you have heard of animals going into hibernation, right? So that evolutionarily, sleep was used to conserve energy, right? So that is another role of sleep. Lots of hormones are produced in sleep, which help us grow, which build our immunity, which also even our sex hormones are produced in sleep. So when you are attaining puberty, irregular menses for girls, etc., can all be linked to irregular sleep habits. So fertility all is linked to good sleep. Right. The other hormones which are produced in sleep are ghrelin and leptin. Leptin is a hormone which gives you satiety. And ghrelin is a hormone which makes you grubby. Ghrelin G, grubby, right? So
grubby?
Grubby, hungry.
Oh, hungry, okay, hungry, okay, grub.
Yes,
okay.
It is a hunger hormone.
Got it.
Whereas a leptin is a satiety hormone.
Got it.
Satiety not in anything else, but only in food.
Food, yes.
Right? Leptin is secreted from the fat cells of the body. And what happens is, leptin, if you don't sleep well, there is deficiency of leptin. So you're awake in the night, leptin is less, you feel hungry. Ghrelin comes into action, which is produced in the stomach, right? And makes you eat.
It's happened to everyone. Yeah. You've not slept properly. You've had a good dinner at 8 or 7 or 9 or whatever. But at 12:30, if you're not sleep, you're like, okay, boss, let's raid the refrigerator.
Absolutely.
And that's the start. I see it. You feel a little growl in your stomach.
So if you don't sleep well, you become obese.
Right.
All right. So many things for sleep. Now, sleep de-stresses you. So if you don't sleep well, you're stressed. So you have a lot of psychiatric illnesses which come up. Anxiety, depression. And then when you have anxiety, you have so many hormones in the body. Again, I'm coming to hormones, right? So I've spoken about 2-3 sets of hormones already. And if you don't sleep well, certain other anxiety hormones come in, your sympathetomimetic hormones, which are called adrenaline, cortisol. All of them get disturbed. And when they increase, it increases your blood pressure. It causes metabolic syndrome. Sleep is required for mental peace. Okay? So again, if you're not having mental peace, your brain needs to restore. So if you don't sleep, cognitive, that also becomes a problem. Right. Learning new skills, remembering old skills, remembering new things, everything gets affected. So much for importance of sleep.
Got it. When you look at children coming into your clinic with their parents, and you've been doing this for 30 years now, what do you see are the biggest changes happening with regards to sleep?
It depends on the age group of the child that you're talking to me about. Okay. So when you look at infants, I don't think much has changed from the child's end point of view. So we know infants will sleep good 18 hours, 17 hours, 20 hours in a day. Infants, I'm talking about age below 3 months. Between 3 to 6 months, babies will sleep like say maybe 13 to 18 hours. It's variable. And then around 1 year, they come to 10 to 12 hours. Post that, they become again 9 to, something around 11 to 12 hours. It will reduce to 10 to 11 hours. And by the time you're about 5 years of age, it is 9 to 11 hours. Adolescents become 8 to 9 hours. They have a little increased requirement of sleep. And then when you are older, like 60 plus, your requirement is around 7 hours, 6 to 7 hours or maximally 8 hours. So before I tell you what's changing, I wanted to tell you what is the normal duration of sleep that is required. So what I'm seeing in children between say 1 to 3 to 5 years of age, nowadays children are exposed to a lot of things, right? So their mind has become very hyperactive. So many parents come and sleep, my child doesn't want to sleep only. Doesn't sleep, is very restless. So we are finding children getting more hyperactive. So this is one change that I'm noticing in most children, that they don't want to sleep or they're sleeping lesser hours. The other change that I'm seeing is we have working parents, right? So I can give you bizarre examples of parents who are doing night duties and how they've changed the child's sleep schedule to kind of match theirs.
I know someone exactly like that.
Yes.
Yeah.
So now parents are working, and in some it is a necessity. In some it is convenience. Okay. Now we have, say, suppose we look at the lower strata. Both parents have to work, especially if they're living in a city like Mumbai, where cost is, how it is, and both parents have to work to make ends meet. They leave the home at 8:39 and they are back home at 8 in the night. Right? So when do they meet their child? After 8:30 night in the. So what did they do? They want to spend time with the child. So they will keep the child awake till 11, 11:30, 12. So children are now sleeping later than what they should have been sleeping. The third reason why I feel the children are sleeping less is the exposure to screens, the blue light. I see a definite shift of lesser hours of sleep. Now, all this, the other change that I see is physical activity is coming down for children. Why? One, there may be no infrastructure, or you have to go to a structured place for physical activity. So what the child does? Screen. So therefore, again, the light which is emitted from the screen pushes your sleep. So children are sleeping lesser is what I'm seeing. So this is the change I see in sleep when I see children coming to me today.
And so you've already told us what is good sleep for different ages.
So I've told you only duration. I've not spoken about the quality.
Yes, of course. Quantity and quality.
Yes. So I mentioned quantity. So quality is, okay, now this is universal for all. I hit the bed. I should fall asleep in 20 minutes. 20 max 30 minutes. If I'm tossing, turning, that's not good quality of sleep. I should stay asleep through the night, through the duration of my sleep. And when I stay asleep through the night, if I manage to get up for whatever, a loo break or whatever, I should quickly go back to sleep. So a maintained sleep. Next day morning when I get up, I should feel fresh. That alarm, snooze, and then I get up is not the way. Ideally, if I have a fixed rhythm, I should be able to get up in the morning at the same time, irrespective of the alarm or with the help of an alarm, and then feel fresh mentally, physically. And lastly, through my day, I should not doze off. If I'm left alone sitting on a sofa, I should not go off to sleep.
After lunch?
Anytime. If I've slept well in the night, as I told you, adults don't need naps.
Well, what you're describing, Doc, for me also is a dream situation. Because there's always something that, troubles it and doesn't make it. Like if I could, for 1 month, if I could have this situation, I think for everyone where, like you're saying, 7-8 hours of sleep every day, uninterrupted, actually sleeping the whole night without any interruption. And then therefore waking up fresh. And therefore the whole day just goes like a song. That's everyone's dream, I think. And I know it's very, very rare.
You need a sleep consult.
I need a sleep consult, yes. Here I am.
Okay.
And what about REM sleep and non-REM sleep?
Okay. So sleep is, there are rhythms in sleep. What you're talking about is the ultradian rhythm of sleep. When I say ultradian rhythm, the sleep has certain compositions, and the compositions are for a reason. So sleep is broadly divided into non-REM sleep, that is non-rapid eye movement sleep, and REM sleep, which is rapid eye movement sleep. Beyond that, you're awake or you're fully awake. Okay. So the non-REM sleep is a sleep which is for physical restoration. The REM sleep is for mind restoration. Another way to remember, the time of sleep when you're in REM sleep is when you're dreaming. You dream only in REM sleep. So a typical pattern of sleep, it's slightly different from children and adults, is the amount of non-REM and REM. So REM is highest in babies. It's around 40 to 50% of the total sleep is REM. And as the baby grows older, by 3-4 years of age, this REM starts reducing. It becomes 25%. And the adult, it will be only around 15 to 20%. So non-REM sleep increases as we age. REM sleep decreases as we age. Why is REM sleep more in babies? You know how babies sleep? They are polyphasic in sleep, meaning they sleep, get up, in 2 hours they are up. They'll take a feed, play a bit, go back to sleep. So they quickly enter sleep through REM sleep. Mind is fresh. A baby does not need so much physical restoration. He's hardly moving, right? So they don't need the non-REM sleep.
They need the mind.
He just needs the mind. And that mind game is enough to trouble a parent, right? They don't need anything more than that. So babies have more REM. And as you grow older, you get more non-REM. So an adult or an older child will enter sleep through non-REM sleep. So I close my eyes, I get into N1, non-REM 1, where I'm closing my eyes, I'm still awake. Then I get into N2 sleep, N2, N3. N3 is deep sleep. You try to wake up a child in N3 sleep, it is like very difficult task. Right? So N2, N3 sleep. And then my cycles go from N2, N3 to REM. So I do an N2 REM, N2 REM the whole night. Okay? The REM is short in my first phase. So the first REM cycle in a child comes around 60, these cycles of N2 REM or N1, N2, N3, N2 REM are 60 to 90 minutes in a baby and about 90 to 120 minutes in an adult. So this keeps on going through the night. And as it goes through the night, your N1 will go away. It will be N2 REM. So REMs will become longer. So in a typical night, you have 4 to 5 of this ultradian rhythm of a 60 to 90 or a 90 to 120 minute cycle where REM keeps getting longer through the night. So this is the ultradian rhythm. So you dream more in the latter part of the night because the REM is longer after 2 a.m., 4 a.m. So this is how it looks.
Deep in the middle of the night, you get the dreams. Kind of before waking up in a way. Got it. So they all are so important.
Actually, you remember everything in the REM. You remember your dreams.
Sometimes. No?
Yeah. So if you are woken up in REM, you will remember everything.
Got it.
Correct? Sometimes you are very deep sleep because N2 and N3 are deep sleep.
Oh.
In children, you have high N2, N3 and adults and REM is also there. But as you grow older, you get more N2 and N3 becomes less. N3 is maximum in children. So about 30-40% of sleep in children is either N3 or it is REM.
Got it. And what about circadian rhythm? How would you describe that?
Very simply, circadian is a day-night rhythm. All right. We get up when we see light. The sun rises, the light should come in and we should get up when we see the light of the sun. And we should sleep when it is dark.
The more I spend time talking to amazing people like you on this podcast, actually, you get concepts in your head, slowly meta concepts form. Everybody's going to get a meta. And it's like humans, as we know it, have been there for hundreds of thousands of years. But the rate of change in the last 100 years has been like, what has it been? It's like unfathomable for the human mind. Our mind is still the same. Our body is still the same as it was 10,000, 100,000 years ago. Till 10,000 years ago, though, there was no change compared to how it was forever. Then you had the agricultural revolution. So people started eating carbs. Before there was no carbs. How would you eat carbs?
So whether green revolution was good or bad is a debate by itself.
Yeah, all that, exactly. So the first thing was carbs. And then after that came electricity.
Yes.
So the light changed, your mind changed. And now you have the greatest thing, the greatest invention on earth. I'm doing this, is the screens. Which is, again, your mind is, we are so overstimulated every day of our lives. Forget children, even adults though. How much stimulation we have, and then we have to try to crush that whole thing. And then, chalo, 11 baj gaya hai. I've consumed more information in a day than my ancestor consumed in his life. Pretty much. And now I have to go to sleep. But my mind, evolutionary wise, is not programmed like that.
Sometimes I see young children with lot of anxiety. Anxiety in the sense, I'm talking about young children, talking about children below age 5.
Right.
Okay, if this will happen, then what we'll do? Then we have to go there, then how will we manage that? Because there is so much of stimulation, so much of information given to the child that the child's mind is not at rest. Now, this is a kid who will have a breakdown one day. Because there's so much, I actually keep telling parents, it's not necessary that you give every information to the child.
Over communication is also a problem.
It is a problem. Parents have to realize what has to be given at what age and how much.
And what is melatonin?
I'll give you a very interesting fact on melatonin, right? So, babies are born without melatonin. Breast milk has melatonin, right? And melatonin starts getting into the baby from the mother's milk to what the baby requires.
Right.
A preterm mother's milk has different amount of melatonin versus the full-term mother's milk. Melatonin in the mother's milk increases and it comes more in the evening time as the baby's circadian rhythm starts, the day-night rhythm. The day-night rhythm in a baby comes between 3 months to 6 months. In some it comes early, in some it comes 6 months, some it may go to 8 months. By that time, melatonin in the mother's milk starts coming in the evening time. So now the baby is getting programmed to sleep in the night with the melatonin coming from the mother's milk, and the baby also starts producing melatonin between 3 to 6 months. So see how nature is so picture perfect.
Amazing.
It will not produce melatonin for the first 3 months because the baby has to get up every 2 hours, 3 hours for a feed. So by 3 to 6 months of age, melatonin will come in the night around 9 p.m. It will peak at 12 in the midnight and disappear at 6 a.m. And that's the time you're supposed to sleep. So melatonin is a sleep-inducing hormone which is normally produced in the body. So if you don't sleep on fixed time every day, body gets confused when to produce the melatonin. Why we destroy it by not having a fixed sleep rhythm. So we have two hormones which induce sleep. One is melatonin, which everybody knows about. The other is adenosine. Adenosine is a fatigue hormone. If I were to simply explain it, you've done a lot of work through the day. You've made 3 podcasts, right? And and in the end of the day, you're tired. So your body produces adenosine. Yeah. Adenosine is also a sleep-inducing hormone. Melatonin is a hormone which is produced by the pineal gland in the brain. And it also gets produced when there is no light exposure. So if you alter sleep rhythm, it gets altered. If you come to screen time from this, so below 2 years, the recommendation is no screen time. The only screen which is allowed for babies is, and it's for multiple reasons, it's not only for sleep. Okay, it is for allowing other, if I'm glued onto my screen like this, I don't even see who's sitting here or who's sitting there or what is the color of your shirt or what are other people doing, so that my brain pathways are being developed. If I allow my child only to be here, and then my child's neurodevelopment is a problem. And below age 2 years, if you give screen to children, you are supposed to give it only for a video calling where it's a human interaction with grandparents. It has to be supervised. Between 18 months to 2 years, you can still give a screen for a very high quality educational content where a parent is with the child maybe for a short time of 20 minutes, 30 minutes. Beyond 2 years, it is only 1 hour, and still it is debatable whether that 1 hour should be given. Again, it has to be high content with the parent along with the child.
Not YouTube kids garbage.
Not YouTube garbage.
I just want to understand, when you have a baby, what is the big mistake that parents make, which then, is very tough for the baby to recover from, just destroys the sleep cycle of the baby?
Yeah, this is a very, very vital question on how to sleep train a baby. Actually, babies hold your hands and tell you how you should sleep train the baby. But as anxious parents, first-time parents, unit family parents, we disregard all those signals. The other problem comes in a busy consult in a pediatric cabin. Nobody talks about sleep, right? Okay. So what happens is, when the baby is small, I already mentioned this, that the baby does require 2 to 3 hourly feeding. But by the time the baby is 5 months old, the babies can now, 5 to 6 months, they can all sleep for a stretch of 5 to almost 8 hours without a feed. So parents do not realize that. So they feel how they have been feeding too early, they should feed the baby too early in the night. And many parents wake the baby up and feed. So that's the first mistake they do. So when the baby starts to sleep at a stretch, let the baby sleep. The second thing that we tend to do is we tend to rock the baby and rock at all kinds and do all kind of things to see that the baby goes to sleep, right? So this then becomes again a nature for the baby to demand that rocking to go off to sleep.
Godi baby.
Yeah, sorry?
The Godi baby. They call
Godi baby, Jhula baby.
Jhula baby.
And some of them, push the Jhula so violently that when I look at it, I said, hello, relax. Okay, that is also a problem. Then the third thing is sleeping on the breast. Okay, When the baby has a habit of sleeping on the breast, every time, see, the babies have something called as awakenings. I spoke about rhythms, right? I spoke about sleep rhythms, right? The sleep rhythms are the ultradian rhythm, which I spoke about. So you have one cycle, REM, non-REM, and then another one. So whenever the switch occurs, the baby can get up a little bit, but the baby can self-soothe himself or herself and go back to sleep. But if we introduce breastfeeding and rocking in these awakenings, then the baby will now depend on rocking, feeding, or whatever maneuver that you may use to put the baby to sleep for these awakenings. Yeah. These are not arousals. The baby is actually not awake.
Got it.
It's just a little awakening, right? And therefore the baby can turn, cry, and go off to back to sleep. It's okay. Let the baby be. And let the baby sleep on the breast. So the baby starts getting drowsy, remove the baby from the breast, put the baby down. Give the baby's favorite toy or engage the baby in whichever way and let the baby soothe himself or herself to go to sleep.
Self-soothing.
Self-soothing. So once you can do this, your babies will sleep like a baby, which meant through the night without bothering you. The discipline here, it's called limit setting. Okay, so limit setting has to be put by the parents. The child will say, I want to go out, I want to talk to grandma and come.
They fight sleep.
Yeah,
because they are so excited to be awake and devour the world around them.
I'm hungry now. Yeah. And the moment the child says hungry, my parents say, mere bachche ko bhook laga hai, so khana khila do. You know?
They're very smart, the kids.
They're very smart. So that limit setting has to come. Then the child will sleep. In the middle of the night, child will get up. The same toy which the child used to induce sleep is by the side of the child. Child can just quickly play with that and go off to sleep. Parents need not react. If you react, the child will ask for your reaction always. Then the whole ritual we will have to do all over again. So don't react. Even if the baby is crying, don't worry. Nothing will happen. It takes only 2 weeks to sleep train a child. If parents are firm, 2 weeks is all that you need.
It's very tough for parents. I remember that period of that crying thing and the baby cries and all that stuff. But you have to be tough.
Crying is a language, baby speaks. Yes. So my first visit with any newborn, I tell the parents, crying is a language he's speaking to you. He doesn't speak Hindi, English, Marathi, whatever. He will cry for hunger, he'll cry for being carried, he'll cry when he wants to sleep, he'll cry for no reason at all. He'll cry for exercising. Okay, it's fair, let him cry. Yeah. Him or her, whooped. I remember I was working in the UK for a short time and I was in the rounds with a senior consultant and there was this 10-day-old newborn baby was admitted. The grandparents were there, the parents were not there. And the baby started crying. And I was with all the team of people from the UK. I was the only Indian in that group. And the baby started crying. And the grandparents did not get up to pick up the baby. Nobody even looked at the baby, why the baby is crying. And as an Indian, I said, ro raha hai, utha lo. Somebody please. And what did the baby do? Looked around, cried for 5 minutes, and there was a wrap around the baby, put that in the mouth. Went to sleep.
Self-soothing,
Is how you train?
Yeah, we overdo it a little bit, yes. So, like these things like rocking the baby to sleep, breastfeeding to sleep, lying down with them, jhula, all these things, they seem very natural and loving and parents love doing it also because they think they're helping the baby. But you call these all props.
Yes.
Why is that?
So they are called props because then the child is dependent on them to go to sleep. We want to make the child independent so that the child sleeps himself, which is natural. In a healthy child should sleep himself.
At the toddler years, which is 2 to 5, what amount of sleep is recommended and what do parents get wrong at this stage?
So 2 to 5 years, baby needs approximately 1 or max 2 naps in the day and a long stretch of sleep in the night. So total hours of sleep is 9 to 11 hours. That includes the naps.
Really 9 to 11 only?
That's
for a 2 to 5, I thought more.
Yes.
But
maybe 12 in some bits. So I'll tell you what, it is each child has a different requirement. So some children will sleep more, but an average 9 to 11 hours is good enough for a 2 to 5 year old.
Got it. And what do parents get right and wrong about this,
So limit setting, timing of sleep. Okay, that is the most difficult. So then you get something called as behavioral insomnia of childhood, where the child will not listen to norms. It will at sleep time will remember everything else that he wants to do, and the parents will not limit set, and then that becomes a wrong rhythm. So timing of sleep and limit setting is the most important thing for a toddler of 2 to 5 years.
How, for many parents, they make the kids like abroad, the children sleep in a separate room from when the baby is born, I've seen. But in India, naturally they say let the baby sleep with us. Parents love it. It's nice for everyone. It seems like a loving, natural thing to do, for sure. It does. And then, of course, it's very hard to get that gone. And then you have 5-year-old kids and 8-year-old kids, 10-year-old kids. You must be seeing who are sleeping with the parents because they can't break it. Every year gets harder. How bad is that actually?
So there are two concepts here: co-bedding and co-sleeping.
Right.
Co-bedding is sleeping on the same bed. Okay. Co-sleeping is sleeping in the same room. All right. So obviously when the baby is just born, most of the mothers are co-bedding the child because they have to feed. It becomes easier. A little later, the baby might go into the cradle and it will be co-sleeping. So it's very, I think it's very social. It's a social norm. In the Western world, maybe even a newborn baby sleeps in the next room and the mother is watching the baby through the camera, and then they're going there to feed. When the baby gets up, it's okay. But India, many people will co-bed and co-sleep. Right? So there was a study which was done from the south of this country where they looked at co-bedding and its impact on sleep. And they found that the baby kept getting up to breastfeed and then go back to sleep, and that's how it happened. And whether that was really bad for the sleep. Fortunately, the data said that this was not really bad for the baby's sleep and the baby's growth, the comfort, the kind of mother and child bonding was better. But there has to be a time till when you can continue. So I feel there is no strict rule here, but generally by the time the child is around 2 to 3 years of age, it's a good enough time where the child can understand, and definitely you can move the baby if you're co-sleeping in one room to even the next room. Right? So co-bedding can probably continue till you're night feeding the child. Then it can be co-sleeping in a cot next to you. And then after 2 to 3 years or 4 years, whichever you are comfortable, the child can move to the next room. So it's how you kind of train your child and how you build your child, you can go ahead. So there is no such fixed rule here.
So the next big phase that comes is the child enters school. A whole different thing, moves away from their parents' house. 8 hours a day is in the school. 10 hours almost, 1 hour going, 1 hour coming. Along with school as tuitions, massive change happens. How much sleep do they really need? And, for our audience, are children getting that sleep or not?
Yeah. When you're talking about children above the age of 5, they need about 8 to 10 hours of sleep. As I mentioned earlier, they will not need daytime naps. Okay, so they have to have a fixed rhythm of sleep, and duration and regularity is the most important thing for this age group. They need good physical activity also so that they tire out. So the physical activity should just not be immediately before sleeping. It should be maybe in the evening time, and that will also help them have good sleep. No screens 60 minutes prior to going to bed. Now in the Western world, children sleep at 7:30 and 8. Okay, but I don't think it can translate into all our houses here. There will be some straight up society here who still follow that, and children will be in bed at 7:30 and sleep at 8:30 and get up at 6:30. Good if you can manage it, nothing like it. But most households, what I see, 9:30, and most of these kids in our country, school, and you mentioned tuitions, and you mentioned classes, and social milieu. So it's not easy for them to get into bed at 7:38 in most households. So practically speaking, even if they get to bed by 9:30 and they sleep at 10, and they're getting their 9 to 10 hours of sleep, it should be good enough.
And is that happening enough?
No.
So what is happening?
So all these extra classes and tuitions, and so children are sleeping lesser. Most kids are sleeping maybe just like kind of 8 hours or 7 hours.
And how does this all translate to teenagers? What do you see in teenagers?
So teenagers, there is a biological shift of rhythm. So the circadian rhythm shifts. So teenagers have a little later surge of melatonin.
Right.
So they would like to get into bed a little later at 11:30. Then comes their social life, their Insta, their networking on WhatsApp, Facebook, whatever. Okay. Plus, there are pressures of academic achievement. So they have to do some projects which they're struggling with at last minute. So they ideally should be in bed by 11:30 latest.
Right,
But
right.
they would go to bed at 2, 3, and then all their peers are awake. They're going to play some games online, whatever. So they're all awake till 2, 3. Now the requirement goes up because I mentioned to you that sleep is required for growth. The growth hormone is secreted in a pulsatile fashion in sleep, right? So teenage is another age where growth is occurring, correct? Infancy is another time when growth is occurring. So you need sleep. Now they have pushed the sleep to 2:33, but the requirement is 8 to 10 hours. So they find it difficult to get up in the morning. So you will have every parent who has a teenage child will complain, it's so difficult to wake my child up in the morning. And in the night, you keep telling them to go to sleep, they won't sleep. Because the requirement is not complete, they can't get up. They literally have to be yanked out of bed. Only then they get up. And then by the time they go to their school or college, they come back home by evening, they're dead tired. They're walking like a zombie. This is what's happening in teenage. So what I have spoken to you about is what is their normal circadian rhythm which gets shifted.
Right.
And they further push it because of all the screens and the social kind of networking that they do. And they get into something called a delayed sleep phase cycle.
And how bad is this delayed sleep phase cycle? Everybody
So it
has
affects them. It affects them pretty badly because in school, they're sleep deprived. Okay, so in so many parts of the world, in the US, etc., they have started, what they did was they made this change that for teenagers, and for, early teens also, that they started schools a little later. Instead of 7, 8 in the morning, they pushed to school to 9, 9:30. Okay. But unfortunately, the data which came even after pushing the school to 9, 9:30 was not very encouraging. Because I guess it was 9:30, but the children still kept sleeping late. So it really did not help them. And in a country like ours, if you push school to 9, 9:30, our buses will be stuck in traffic jam. They'll not reach school. So that will be another problem.
How do we regulate weekday and weekend sleep in teenagers?
So weekdays and weekends, especially for teenagers. So you will have some schedule in weekdays. Teenagers will have some outing in weekends.
Yes.
Come Friday, Saturday, they're gone till 2 a.m., 3 a.m. in the morning.
Course.
And then the circadian rhythm goes for a complete toss, even if they're trying to maintain one. So what you have to instruct is, of course, you have to limit the time till which they're out, which is very difficult, but you can make an attempt, okay, 2 o'clock or 1:30 is max. But what is most important is, so suppose they went out on a Saturday night, on a Sunday morning, if their routine getting up time was 7, max they should push it till 8.
So they're tired in the evening.
Yes, and so the circadian rhythm does not get so confused. Okay, so that is one thing parents can do, that, okay, we will strike a deal with you guys. You want to go out, but tomorrow morning you have to still get up by 8. 1 hour is the extra sleep time we'll give you. If you're very tired in the evening, let's see if you need a short nap. We will take a call on then.
Nowadays, you have a lot of algorithmic content on YouTube and all that stuff that is just made to stimulate the kids and to keep them watching it. It's the same for adults also. Is that affecting sleep differently from, regular, like what content should a child watch? They want to watch on weekends or here and there, something, fun or something. So what do you recommend versus what is a disaster for children?
So any content which is going to cause an emotional arousal, a violent thing again which will cause an emotional arousal, anything which will cause stress will disrupt your sleep. But otherwise, whether it is generated through AI or any other way, it's basically the same.
Got it. How easy is it to disrupt the sleep cycle and how easy is it to get it back, this rhythm?
Disrupt like this.
Yeah.
You can disrupt your sleep cycle, but if it's like
In
this,
like one day.
So it is for that day. It's not like it's going to be chronically disrupted. But see, I spoke to you about how you can weekend and weekday can be rectified, right? Just by the same day it will get rectified. But if you keep on doing it day on day, then you get into a process of sleep deprivation. And that is like, and then you cannot say, okay, weekdays, I will only sleep 4 hours. Weekends, I will sleep 12 hours to compensate. So when you do those 12 hours to compensate on weekend, it's like you're just paying the interest on a loan that you have taken. Your sleep deprived is your loan, and you're just paying the interest. Your capital is still there, and slowly
you're not paying back the loan. You cannot pay back the loan.
You're not paying back the loan by completely. So if you're doing it day on day for a month, and then it starts impacting you. Okay, because when you sleep for a longer period on the weekend, you will be physically restored to some extent. You will be mentally restored to some extent, like you'll be more attentive. But what you cannot restore is your cognitive skills, which will show a decline if you keep on doing this over a month or two. What it will not restore is what it is changing in your hormones and your metabolism. So all that will start changing. So typically for us to label a disease, like we call in teenagers delayed sleep phase syndrome, we're looking at for 3 months the child has been doing this, then we call it a disorder. And we start want to rectify it.
Is there anything else we can do to help the kids sleep better? To have a better environment for the kids, what can we do? Is it supplements or sprays or I don't know what, blankets, air conditioning?
So a happy child, no emotional stress, a connected parent, giving time to the child, also a fixed schedule, a full stomach, a comfortable bed, a comfortable bed, comfortable temperature, should be good enough for a child to sleep who has no other medical ailment, right? I don't think you need supplements to put a child to sleep. Sleep is something so natural and it should come naturally. Provided these are basic things. We're not really asking for anything more.
Let's just pause. Subscribing here isn't just about supporting our channel. It's about choosing what kind of thinking you want around you regularly. So if that resonates, you know what to do. So now I just want to talk about, when we had spoken last time, you spoke about a bunch of sleep disorders. And of course, I've heard of them from various parents. Can you tell us about the whole spectrum of sleep disorders that exist for children?
Okay. So sleep disorder, breathing is, as the term suggests, it is disorder of breathing during sleep. So when we sleep, we continue to breathe. We continue to breathe till our last day of life. The purpose of breathing is to take in oxygen and throw out carbon dioxide. If anything obstructs this movement of air while we are sleeping, and why more so during sleeping, I will just tell you, it will cause sleep disordered breathing. Now, when we sleep, our muscles also relax. Okay, from the nose to the lungs, we have something called as a pharynx. Now, pharynx is a tubular structure which has got only muscles, and it doesn't have any bones. It has a few cartilages. Now, all of them also, and when we are awake, it is kept open with the help of dilator muscles, right? The pharynx has a function of swallowing food. So so you take in the food, there is food pipe behind and the windpipe in front. And in the windpipe are the vocal cords which help you speak. Okay, through the vocal cords and the food and in the windpipe, your air will go in for breathing. So pharynx is a structure which is collapsible and soft. It has to be collapsible and soft because it has to regulate 3 functions. So when we have to eat, the windpipe shuts, the food goes into the food pipe. When we have to breathe, the windpipe opens, the air has to go here into the windpipe. When we have to speak, air has to go in a regulated fashion through the windpipe. So all this coordination
very complicated, yeah.
Very complicated is done by
area.
the pharynx, right? And when we sleep, it collapses because it has no bones. It cannot have bones because it has to keep, contracting, relaxing, depending on whether we're eating, swallowing.
It collapses when we sleep.
So when we are sleeping, it becomes narrow because the pharyngeal dilators are not functioning as much as they should be.
The muscles relax.
Absolutely. So if a person has normal muscle tone, nothing will happen. If a person has no obstruction, nothing will happen. The body can compensate by deep breathing, by little more force in breathing, which when you sleep, how you breathe. So that's what you do to compensate, to keep it open. But if you have any problem which alters the tone or which obstructs the pathway, it will cause difficulty because it's already become narrow and these things are further obstructing it. So you will choke The oxygen will not go in. And when you start choking, first when there's obstruction, the first thing you will do is start snoring. And then if you are while snoring and oxygen doesn't go in, what will the body do? The body will wake you up because you can't breathe. You have to get up, otherwise you will choke to death. So you will get up. That's how you will get up. Okay? You will get up to breathe again. And then you go back to sleep. The whole process starts again. Then you will get up again. So your sleep will get totally disrupted. So what happens in sleep disordered breathing? Oxygen doesn't go in. Carbon dioxide doesn't come out. Your sleep gets disturbed. You keep getting up through the night. This is sleep disordered breathing, and it occurs in various kind of grades, to simple primary snoring to very obstructive sleep apnea, which you must have heard of, right? Now, what happens in children? Why this can happen? It can happen in everyone, adults also. But in children, the commonest reason is enlarged tonsils and adenoids. So adenoids are basically, tonsils and adenoids are our policemen. Okay? You know what? Say, for example, you live in a building. You put a security guard down because you don't want unwanted people coming in. Here, in this building of our body, the nose is open, the mouth is open, anything can come in. So we have to have multiple security guards. And one of the security guards the body has appointed is tonsils and adenoids. The tonsils sit in the throat, adenoids sit behind the nose. And they have to function for the first few years of life, maybe 4 to 6 years of life, till our other body systems take up the function. But if we keep on getting infections, these tonsils, adenoids, or if you have too many allergies, sometimes because of that also, these tonsils and adenoids become large because they're constantly working. And they are supposed to settle down when the infection goes away. But so many things, infections, air pollution, allergies, does not allow the tonsil adenoid to settle down. And they're large. And they, when a person sleeps, obstruct the airway. So that is the commonest reason why we are seeing children with sleep apnea. The other reasons include obesity. Nobody talks about the pandemic of obesity we are sitting in.
Childhood obesity.
Childhood obesity. And so...
it's a pandemic.
120%. Post-COVID, it has skyrocketed, right? Because of, it's our lifestyle issues, the food we eat, the activities that we don't have.
What is the sign to a parent that my child is, overweight/obese?
Okay. So here I need to give you a basic concept. First 2 years of life, a bachchu who's born normal, like maybe 3 kg, he becomes 4 times his birth weight at 2 years. He becomes 12 kg, right? Now from age of 2, 3 till about 10, the body is in a slow phase of growth. Height will grow 6 centimeters a year. Child will gain 2 to 3 kg max in a year. Now this phase of life, if parents notice that the child is gaining more weight, and it is typically happening because of the number of, outside eating and the kind of foods we have. So this is a time when the children slowly, the obesity starts creeping in. This is the time the child should be thin, lean, active.
So the child should be that's what I...
Thin, lean, active. Parents will come and say, iski haddi dikhti hai, aisa dikhne do. This is the way he should be. So
the child should be thin.
Thin.
I think this is... parents will get angry with me, but I think this is the most important thing that parents have to understand.
Yeah, they should be in the growth chart.
Right.
They are growing as per growth chart. So we have height and weight charts and body mass index after the age of 5 years.
Got it.
Anybody can download this app.
Because all these people we know, they have pediatricians. But I don't think the pediatricians are flagging it that your child is overweight.
100% they are flagging it. The parents pay a deaf ear to it. I want them to listen. Everybody should download an app called as Indian Academy of Pediatrics Growth Chart.
Got it.
Chart your child on that. Stay in the 50th centile.
So the child should be in that 50th percentile.
Absolutely. So this is the reason why obesity is occurring, because parents keep on feeding their children. Show your love through everything else but food. What your child today needs of you is your time. Period. Child does not need anything else.
And is there any, if you don't want to, for the parents who don't want to download the chart, just as a quick thing, is there a visual thing also that you can see that, yes, this child is overweight?
So that is very subjective. I don't think I can say that. It's like weight on height and on
No, but
parents'
also not
height.
weight only, like just like the
No, if you're
girth,
abdominal
girth.
girth, if you have too much of fat, you should see your six packs of your child. I mean,
You
they
should,
are
huh?
not the. I'm not
Right.
not six pack. The
Flat
muscles.
stomach.
It should be flat stomach. The
Ribs.
skin. Yeah, it's okay to see them
Yes.
as long as the child is as long
So
as.
the child should not have any extra fat on the girth.
No, not at all. On the cheeks also, chubby cheeks are okay for a toddler, not
Right.
beyond that. Then there are a lot of other disorders which parents should be aware, but they are not common and they are more medical. Like you may have children with abnormal shape of the skull. You may have certain syndromic conditions like Down syndrome, which is very common. 100% of children with Down syndrome will have sleep apnea. Okay, so they should be checked latest by the age of 4 years for sleep apnea, because that it further worsens their mental capacity. And there are a lot of children with neuromuscular disorders where their muscles are weak. Now, in those kids, they tend to have sleep apnea. And if you do not identify sleep apnea early and you do not treat it, it can actually destroy their lungs and kill them early. So it's very important that this whole segment of children who can have sleep apnea should be picked up and they should be investigated and treated, because this is all treatable and preventable. So
what are the symptoms of sleep apnea?
So sleep apnea, the symptoms are, so though the symptoms will give you a cue, but it cannot conclusively prove that there is sleep apnea. So you need to investigate. So there are nighttime symptoms and daytime symptoms. So nighttime symptoms are heavy snoring. If the parents have noticed that the child is suddenly stopping to breathe when he is sleeping, he goes to sleep like that, and then he goes,
Right.
So, or he's sleeping in odd postures to keep his neck extended so that the airway is open, right? Or there are abnormal movements in sleep. They're continuously moving in the bed. Or this child is getting up more frequently. So these are typical nighttime symptoms. Some children who are bladder controlled will suddenly start bedwetting, because when they sleep, they go into deep sleep and they may suddenly bedwet. So who was well bladder trained and now has started bedwetting. So these are nighttime symptoms which can come. Daytime symptoms is inattentiveness, dropping school grades, to some extent ADHD, early morning headaches, and the child in tonsil adenoids is always keeping his mouth open. And when he speaks, mouth breathing, and when it's mouth breathing in the night, in the day, and when they're speaking, you feel that there is nasality in the speech. Okay, these are all daytime symptoms where you can have. And then rest, a doctor examination of the ENT, the blood pressure, etc., will tell you whether the child has sleep apnea or not.
Everybody thinks a snoring kid is so cute. Oh, so sweet, the baby's. How bad is snoring for children?
So, snoring can be normal. So, 15% of children will normally snore.
Oh.
Okay. So, you need to identify
That's
which snore. You need to identify whether the snoring is normal or abnormal. Okay. And sometimes you may have a child who has really had a sports day at school and then he's absolutely fatigued. He might just come home, hit the bed, sleep, and he'll snore. You may have a child who has a cold and cough and he'll snore. That's fine.
But those are temporary. Is long-term snoring normal for a child?
Yes. So children who have snoring with associated notice, gasps, snorts, noisy breathing, wakenings are abnormal snoring. Children who are heavy snorers and who continue to snore, which are what we call as habitual snorers, who snore for maybe 3 days in a week and for 3 months they're continuously snoring. These are people whom we need to investigate. Okay, so snoring with abnormality and ruling out primary snoring. So sometimes history may not tell you. Many times the child is sleeping in the next room, parents don't even notice. And all the sleep apnea events occur more in the REM sleep, which occur in the latter half of the night after 2 a.m. in the morning, and it may go unnoticed, right? So you have to look at the whole spectrum. I mentioned the daytime symptoms, the nighttime symptoms, snoring with its associations before you come to a conclusion. So I think every snoring is not abnormal, but you will need to tease out the proper history, investigate to understand which of it is abnormal.
You mentioned something which is on every parent's tongues, ADHD. Every child, so many children have attention issues now. borderline ADHD, people say, or ADD. These words are just thrown around everywhere. Because you talk about how sleep can help this and cure this.
Every ADHD does not have sleep apnea.
Got it.
But ADHD could be one of the features of sleep apnea. So I had a child. This is a kid who came from outside Mumbai. Basically came for the fact that the child was not concentrating well in school. Okay. And the child was dropping school grades. And the parents noticed, the teachers noticed that this child was less attentive. And rather than ADHD, was less attentive than what he was earlier. Okay. And this is how they came. And I went deep into the history. The parents told me that this kid has never slept only properly through the night. He's been tossing, turning. When I examined the child was obese, had large tonsil adenoids, had dental malocclusion, and had severe sleep apnea. Extremely severe sleep apnea, which had gone unnoticed. This is a 10-year-old boy.
Wow.
It was not a small baby. Okay. And then we did a sleep study. We got his tonsil adenoids removed. And we thought he will need more therapies. Fortunately, he settled with just removal of tonsil adenoids and little lifestyle changes about his obesity, etc.
And his ADHD got better in it.
Absolutely.
I want to talk about one thing that you mentioned. The word itself sounds very scary. Parasomnia. Sounds like paranormal activity or something. What is that exactly? And I'd love to hear some stories about how you cured people with it.
So parasomnia basically is where the wake stage and the sleep stage merge. So a person will suddenly get up in sleep, but he actually may not be awake also because he's still sleepy. Okay, so why does it occur? So it can occur if the patient's sleep hygiene is not proper. So then he has confused sleep. Then, or if the child is sick, or if the child is some stress, or there is a family history of parasomnias. Okay,
like sleepwalking.
Like sleepwalking could be run in families, right? So parasomnias are of two kinds. One is called the non-REM parasomnia. If you remember, I mentioned about the sleep stages. So that non-REM parasomnias occur in the first half of sleep. And REM parasomnias occur in the latter half of sleep when the REM sleep is bigger. So the REM parasomnias in children are fewer. Like the nightmares are the REM parasomnia. So a child will get up suddenly crying, shouting, I can see a ghastly bear in my room and that bear is going to eat me up or whatever. Okay. Here, the child actually gets up. He actually, in his dream, has seen a bear. Okay. And you can console the child and put the child to sleep. And the next day or maybe the next whole week, in the evening time, in the night time, you tell the child, bears don't exist. They cannot come into our house. That was just a dream. It was fictional. It was not true. Then the child, and then maybe you can say, okay, there are happy bears also. And these bears are not out in the jungles. They're there. They're friendly with kids. So carve a nice story, a good ending, happy story before the child goes to sleep. Then the child will believe that these bears are not really going to harm him. And the child will grow out of nightmares. So that's for the REM parasomnia, nightmares. Now, when it comes to non-REM parasomnias, actually the child is asleep. But the parents will feel that the child has got up. So we had a child whose parents were really worried. So they brought this 3-year-old, I think he was, 3-year-old. He kept getting up, shouting, screeching in the night, this is that. And then talking something very irrelevant. Where is mama? I can't see her. And mama is only carrying him. This is that is that, something this, something that, something like that, right? And parents are trying hard to console him because he's crying hard, but they can't console him. And he keeps on doing this for 20-25 minutes and then goes to sleep. And he does it night on night, right?
Oh.
So these are called confusional arousals, and some of them are night terrors, where you may be actually having sweating and the child will be very anxious, etc. But next day morning, if you talk to the child, you did this, he has no memory of it. He was actually asleep. So parents should understand that these are benign things and they go off with age. And you have to see that you just have a regular sleep hygiene. And if it's an infection, etc., it will pass anyways. And just be there with the child to ensure that the child is safe. Console the child. Don't lift the child, start walking. He's actually asleep. Just pat him there. And just ensure that...
The eyes are open or shut?
Sometimes it's open, sometimes it's shut. But they're asleep.
Open but sleeping.
Yeah.
Wow.
And they may just look like this, and they may go off to sleep again. So just pacify the child in bed. Ensure that the child is not going to injure. Even if you are talking 100 things, it's not going to help the child. It'll pass with age. Very few children need medications, but most of them it passes with age. Sleepwalking is also a non-REM parasomnia, but it can sometimes be dangerous because the child may walk out of the house, because they can actually open the door, because they're used to doing it in the day. So they can actually walk out, they can injure themselves. So you have to be sure that if the child is sleepwalking, you should ensure safety of the child. It's not harmful, excepting the fact that the child may injure himself. Again, the same thing, the sleep hygiene is very important, that you maintain that so that these become lesser. Sleepwalking may even go into adulthood sometimes, but most of the other parasomnia settle with time.
So what should someone do if their child is sleepwalking? Because like you said, they can get injured, they can open the door. So how do you tie them up, or what do you do?
So first, calm yourself.
Calm yourself, right? This is not a horror movie.
Parents need to calm themselves first, okay? Make your house child-proof. Like when you make it for small children, like you make it sleepwalking-proof. So maybe the room in which the child is sleeping, close the door, okay? Put him in a bed which has got side railings so that he cannot jump off the bed. So even if he gets up, he'll just be around there and be around the child if the child sleepwalks. Put a camera if you want to see, etc. So you will have to make it child-proof.
But how do parents even find out? Because they're sleeping in another room. How that itself must be such a scary.
Yeah, so it can be, but if you have made safety arrangements, and if the child is going to fall, like some people have seen, put another mattress down the bed also. So if he falls, the child will fall on the mattress and not injure himself.
Got it.
So something to the safeguard the child is what you need to do.
A 9-year-old who is still wetting the bed, what does that, what is that a sign of?
So, bedwetting can be primary or secondary. Primary is when he has never attained control right from the word go. So, there the reasons are different. When you're talking about secondary bedwetting could be a sequelae or could be a consequence of an obstructive sleep apnea. So, you need to treat the primary cause, the obstructive sleep apnea, and that should settle down then.
And how does obstructive sleep apnea, which is breathing, cause bedwetting? It's so strange. You wouldn't think that.
Yeah. So what happens is when you are obstructed, you will get up and then you go to sleep again. You will get up, you'll go to sleep again. When you hit the bed, when you go to sleep, because of these frequent arousals, you may go into very deep sleep. When you go into very deep sleep, you will bedwet. Don't lose control. So it's something like this. Suppose you are having a very disturbed sleep any particular time. When you actually sleep, you will quickly go from non-REM sleep to REM sleep and get into deep sleep, N3 sleep. You will skip the early stages of sleep when you sleep, and then you can get bed. That's how you lose control and you would bedwet.
What is rhythmic movement disorder in infants? And is it dangerous?
No, it's not dangerous. It's like a self-soothing behavior.
Right.
So a child may do something called head banging. He just bangs his head, goes on banging in sleep.
Not dangerous.
It is dangerous because it can injure himself. But as such, the behavior is a normal behavior because it's a self-soothing behavior. Or the child can have rolling movement. They just keep rolling, and then they'll go off to sleep. Okay, it can occur in sleep. Again, this is a parasomnia. It's not a parasomnia. It's a movement disorder, and these are disorders which occur in childhood. And then the children outgrow it with time.
And what about mouth breathing, both awake and asleep? How bad is that for children?
So, if we had to breathe through our mouth, God should have given us a nice flat face without a nose. But He's given us a nose, and nose has a function. What it does, it filters the air, okay? The first line of defense is inside there, mucus, which traps the dust particles, the bacteria, the cilia, which keep brushing, and the hair, which are there, which keep brushing and removing. And it also humidifies and warms the air so that it doesn't irritate my airway. So therefore, we should breathe through our nose. Mouth is for talking and eating, right? Not for breathing. But if my passage is blocked, right, from the nose, if behind there are adenoids which are sitting, behind my throat, if tonsils are sitting, there is no air which can pass through my nose. I'm compelled to breathe through my mouth. So mouth breathing is a marker of obstruction in my nose, therefore I cannot use my nose. I have to breathe to live. I will breathe through my mouth.
And what does that do to a child's face, jaw, and teeth?
Yeah. So that's one more way of looking at a mouth breather. is when a child walks into the clinic, you can see a child whose shape of the face has changed. It becomes long. So what we call is adenoid faces. So the child is like this. Okay, because he's constantly mouth breathing. So the whole shape of the face changes. Okay, and this can, if not rectified, can actually change his looks in the future.
Something I really wanted to know from you since I met you the first time. You told me that you have a sleep lab. I'd never heard of a sleep lab, except I thought it's something to just sleep in for adults, but it's not that. So
it's not a pod.
It's not a pod, exactly. For me, a sleep lab is in a cool workspace, a little pod where you can take a nap. What is a sleep lab, and why should one go to it?
So it's a diagnostic lab. It's to diagnose all kind of sleep disorders, especially those disorders which are related to sleep disordered breathing. Okay, of course there are other non-respiratory or non-breathing disorders also, which we can diagnose by doing a sleep study in a sleep lab. In medical terms, it's called as polysomnography. And polysomnography comes in variety of grades. So from 1 to 4. So in children, we do polysomnography or sleep study. We do type 1. So what do you mean by type 1? It has got multiple kind of accessories, and it is done by a technician who's monitoring your child through the night. The accessories are one to stage your sleep. I spoke about non-REM, REM sleep. So there are multiple leads which are fixed on the scalp,
like
on the
electrodes
chin.
or whatever.
Yes, electrodes on the scalp, on the chin, around the eye to stage sleep. Okay. Then there are multiple electrodes which are fixed to check your breathing. So your breathing, you'll have pulse oximeter. You have something called as ETCO to monitor to check your carbon dioxide.
Where does that go?
So you put a cannula in the nose.
Oh my God.
Okay, so the 2 cannulas on the nose, it's like your oxygen that you would take. So something like that. So it measures your apnea, how many times you stop breathing, hypopnea, how many times you get shallow breathing. And on the top of it sits the CO2 monitor, which monitors the carbon dioxide. You also have, for the respiration, 2 belts. One is on the chest and one is on the abdomen. This chest and abdomen measure your movements. When suppose you have an apnea, what happens? Suppose I'm breathing and I can't, and something obstructs me, so I'll go. So my chest and abdomen will move. Or if it's an apnea which is coming from my brain, there may be no chest and abdomen movements. So it measures all those apneas. There's also a monitor on the neck,
Oh God.
which records your snore.
So it's really looking at every aspect of your physiology
Yes.
when you're sleeping.
So we measure which stage of sleep, did the oxygen drop, did the carbon dioxide increase, were there any parasomnias, did the patient get up, were there awakening, why did he get up? He got up because the oxygen dropped, or did he have an abnormal movement? So we put some electrodes on the leg also. So he had leg movement disorders in sleep. So that awakened him. A respiratory event awakened him. How was the structure of his sleep? How was the architecture of the sleep? The whole sleep had proper REMs, non-REMs. So the whole thing is then made into a proper report and given to the patient to understand whether he has sleep apnea. And there are clear cutoffs, and that of course is medical jargon, where we can tell you whether the patient had a sleep apnea or not.
So what kind of child should come to the sleep lab?
So any kid who's snoring with the associated apneas that the parents may have noticed, or the daytime, nighttime symptoms that I mentioned, children with obesity, children with tonsil adenoids, children with Down syndrome, children with muscle weakness, neuromuscular disorders, children with other craniofacial disorders, which I mentioned, children with disturbed sleep who have something like periodic leg movement disorders, what we call as leg movements in the sleep, which are disturbing the child's sleep. We also have another set of disorders which are called as hypersomnolescence, where the child is always sleepy. So there also we may want to do a sleep study to understand why the child has, why is he so sleepy.
When you put all these things on the child, are they comfortable to sleep, or is their sleep disturbed?
So that's a technique that we have to follow. We have to prepare the child mentally. The parents also we need to prepare.
Right.
And there is a small technique, and it is a challenge, but we need to have good technicians. So I have done around 1,000 sleep studies by now, and maybe around that much. But I don't think we've had problems bearing 2-3 children, and those were special children with, like last night also there was a sleep study. I got a call at 3 a.m. in the morning from my sleep technician, said this kid has not slept at all. But this was a special child, and so these are kids we need to handle a little differently, a little more patiently.
And they need a sleep study anyway because they have some more serious problems. Basically.
Yes.
Can you tell us about a child whose life genuinely changed because of this sleep lab?
So the biggest response is in children who have neuromuscular disorders. Now, there was this little girl who came to me all the way from Banaras. She came in an ambulance on oxygen. When she came to me, she was, I think, around 4.5 years old. 4.5 years old. In the last 2 years of her life, she had 3 admissions to hospitals there. Out of the 3 admissions, 2 admissions were she was on the ventilator for about 10 to 15 days. And she had developed some kind of pneumonia. They said that she's not getting better. And this time when she came, she just got discharged from there, but was on home oxygen and she came. So what she had was, it is a myopathy called a Sillenon myopathy, where the muscles are weak. So when your muscles are weak, when you sleep, they're not functioning. You can barely breathe. So your whole airway system collapses. So because it was collapsing,
these intercostal muscles and all,
everything is weak for her. This was weak, this was weak. Okay. So when she sleeps, the whole thing collapses, and these kids then can barely breathe. The carbon dioxide goes up, oxygen goes down. They are more prone to aspirations, developing pneumonias, and that's what it was happening to her. So we first diagnosed her that she had a myopathy, which was not diagnosed. And then we did a sleep study on her, and she's on home CPAP or NIV, she's on BiPAP actually. And it's now 2.5 years that we are following up with her, and not a single hospital admission. Another kid who came with a similar disorder, another neuromuscular disorder, the parents brought her to us because she was continuously sleeping in the day. She just couldn't keep, while we were talking to her, the parents, she went off to sleep. Because her carbon dioxide in the blood had risen to much above the levels that are acceptable, and excess carbon dioxide will make you sleepy. Because she was not breathing in the night, her carbon dioxide levels had gone so high that we had to admit her in the ICU, then put her on BiPAP. And that girl is absolutely good now. She did an air travel and she came back, and the parents were so delighted.
And Doc, what do you think of something that's very common now is video games, especially boys, all boys, some as 4 years old, but between 6 and 8, all boys start playing some video game or the other, which is 10 times more stimulating than watching something. What do you think of that?
So get them out to play. Go with them. Go play with them. Bond with them. Right? So these video games are very, first of all, if you've seen a child playing, his eyes, you won't even blink, you're going, because if you blink, you will miss out shooting somebody, I guess. And so that is...
And their posture is like this.
Posture. It is. It's okay. I feel you should discipline them in such a way, okay, you are allowed over a weekend for half an hour, 1 hour or something like that. It has to be controlled. There is no shortcut to control here. So I guess you have to find your own ways to control your children, and you will find it. So best is to time it and maybe put it like a small reward to something they may do very well the whole week, and it may work like that. And it should not happen that we are playing and asking them to be controlled.
Yes.
So parents should set examples. So children follow what parents do and not what they say. So that's very important, I guess.
How did you get into this whole sleep universe, Doc? Because you're a pediatrician you started with, and then you got into lungs, pediatric pulmonologist. How did sleep come into the mix?
So sleep medicine is a part of pulmonology. When I wanted to set up a sleep lab, that was about, I think, 15 years back. The labs are very expensive. Okay. And
the equipment.
The equipment is expensive. So when I wanted to buy it, everybody told me you will not get a return on investment. Also, everybody talks in ROI. But that desire was there within me. So I kept it there, but I suppressed it. The moment I thought I can spend this much money to set up a sleep lab, not worrying about the ROI, I just went and did it because I felt it was a felt need. Sleep is not even taught in the medical curriculum. So even doctors are not trained in sleep until you start doing super specialization in pulmonology.
Got it.
In fact, I set up a trend of giving certain exams for sleep. So I gave the World School Sleep Certification exam. I was one of the first few pediatricians in this country who gave this exam. And now I have a lot of students who are giving this exam. So when I thought about it, it was a felt need. It was a niche area. It was a neglected area. And I could see many problems coming with the obesity that was on the rise, that this would be a felt need. And pediatric sleep was never spoken about. Adult sleep was still spoken about in few centers, but not pediatric. So, just a passion which kind of, led me to develop it and bring it to a level that today many people talk about sleep medicine in pediatrics.
Amazing. So you're saying most pediatricians are not aware, not trained in sleep?
Not really.
A parent listening to a podcast or hearing it, who is now thinking of children's sleep because of what we've discussed, what is the one thing you would want them to do?
So sleep hygiene and training starts early in life. You must start training your children by the time they're about close to 6 months of age. So that's non-negotiable. Even crying it out is okay. It does not impact your child. Because a healthy sleep leads to a healthy child with a healthy mind and a healthy body. So if you don't have healthy sleep, you will miss out on many things which the child needs to develop. So I would say healthy sleep, healthy mind, healthy body. And that is very important.
Thank you so much, doctor. It's very, very insightful.
Thank you so much for calling me.
Thank you.